Johnny-vos joining us.
We're talking deep tissue massage, among
That's
other
right.
things. Welcome, Johnny. So nice to meet you.
Thank you. It's great to be here.
And you seem to have a very interesting story, because when we ask, how do you get into deep tissue massage? Were you into football or
Well,
professional sports before? Or what got you here?
I don't know. Well, I've always enjoyed playing sports. I mean, I was a rough kid doing lots of different things, but born and raised on a farm, and part of being on that farm meant that I was around animals a lot. It was a dairy farm. So I was always interested in, as a kid, helping the animals, any animals that were hurt, stuff like that. But I found out later on that it didn't just extend to animals, but also like family would come over, friends would come over, and I'd be like, oh, I see how they're holding their wrists. I was like, is that bothering you? Could I take a look at that? And I'd start to squeeze it and play around with it and stuff. So it's just something that I always...
So you had that innate compassion, and you tuned into what was off in living beings?
I guess, yeah. And I didn't really think much of it back then, but it was just, I guess, more of a challenge or anything than anything to me. And I liked, the trade-off for me was, just being able to help. I loved helping. Helping people. So, and that was my way.
Well, like when you were working with the cows, like how would you help?
Well, like for instance, if an animal went lame or an animal was injured or something like that, or a dog got hit or a cat got hit. I'd be the first one to go there and, put a splint on the leg of the dog and make sure everything's okay. I just always wanted to. I mean, when I was younger, I dreamed of being a doctor. I looked up at my family doctor, Dr. Jack Veenstra, actually, and he was my hero growing up. I just saw how he took care of. I think he had thousands of patients. And just caring for people. It's really quite an incredible thing to help.
And would he travel? I remember growing up in rural Europe,
yeah.
And the family doctor would actually come to you.
Yeah.
Only much, much later would he have actually an office, and you would go to see him. They would come to you.
Well, he did have a little clinic office, and he did his rounds at the hospital. But in addition to that, he would go and visit anybody who, couldn't make it in.
Yeah.
I know that my appendix burst, or were infected, and they ended up coming out to the house and checking me there, and then rushing me to the hospital for surgery. Mm-hmm. But I don't think that happens here in the city at this point. It would be nice to see, but...
So that was as a young boy already, you had this desire and ability to see what could be done with something that was ailing in an animal or human. How did you learn about putting a splint on a cat who had a broken leg? Who told you that?
Oh, I don't know. That's a good one. I guess it just made sense to me, Mm-hmm. And probably from my own... stuff. That's a good question. I'm going to have to think
inner
about that
wisdom.
one.
You just have this knowing from deep within yourself.
Well, and I also got this crazy belief that, maybe sometimes gets me in trouble, but I think that, if you can put your mind to it, you can achieve just about anything, right? So I always figured, there's a way to fix anything and everything.
Well, this is now leading edge, neuroscience,
right.
Neuroplasticity, or, mind over body. There's a lot written about it right now, that more and more people find out that how did they do that? They instinctively, when we are hurt, initially we put our hand on it.
Yeah.
It's just an instinct, right?
Yeah.
So why do we do that?
I have an answer for that. Do you want to know?
Go ahead, of course.
Well, when you bump your head, what's the first thing you do when you bump your head?
You put your hand there.
And you scratch it, right?
Yes.
And I truly believe the reason that we do that, or we put our hand on it, is because, instinctively we are creating a stimulus greater than the pain one that we're feeling to cover that up and distract us while that pain diminishes. That's just my theory.
That makes a lot of sense.
Yeah.
Could be. So then you're on the farm. You have that ability and that desire to help.
Mm-hmm.
Why didn't you go to medical school? Maybe that's not a good question. Why?
Well,
what
back
happened
then,
next?
it was just, the reality came that my parents didn't have, they told me at a young age that they were, if at best I might be able to go to 1, maybe 2 years of college somewhere, and they're not even sure if they could afford to pay for that. It devastated me as a kid because I had my eyes, stuck on this. But instead of fighting for it, I actually turned and put my tail between my legs, and I went out and did construction for the next 6 years. So I essentially bought into, that belief that I wouldn't be able to do it. And then at the age of, 21, I guess around 21, I took a look and I realized that, hotels had become home. I started calling hotels home, I was away from home all the time, and I'm very much of a, family. I like to
because
be
you
around
were
people.
traveling for your construction?
Yeah,
just to
sorry,
get clear?
traveling from, hotel
From one
to hotel.
construction site to another.
Yeah.
You were never at home with your family. You were
Yeah.
always alone in a hotel somewhere.
Yeah, and
Okay.
then even so, even then I remember at times, anybody was hurt and stuff like that, they would come and talk to me, it'd be or about nutrition, stuff like that. I was always interested in that. So I realized that, I didn't want to do this anymore. I went to go see an old high school guidance counselor, and that's when I found out that you could actually go to school for massage therapy. I was like, really,
So you quit construction, which pays good money, I imagine.
quit, yeah, and I went to massage school. Actually, I called up too, and there was this one school, and she said, well, it's unfortunately the courses are full. I'm like, okay, just hold on, I'm going to come and see you in person. And I drove down to London from Guelph, was where I was living at the time. I got my suit and everything on, and I drove down, and I just sat there, and I just decided that when I got there, I wasn't leaving until she accepted me in the next course, and sure enough, she did. She put me in the next course, and that was it. I was on fire. I was so excited, and the rest is history.
But why massage? Because there's a lot of different kind of healing things you could have chosen, but what was it about the massage that drove you?
Well, to me, it was easy. It was easy in regards to, it seemed natural to me. I already enjoyed, working, doing certain manipular things on people. But I don't know, I guess to me it was the least complicated way for me to get into the health industry and make an impact without, if I wanted to go to university, I would have had to go back and get some refreshers, high school, things like that.
Yeah.
It was just...
And you look at 10 years studies to become a medical doctor.
Yeah, and it was 2 years in, out. And ultimately, I wanted to get working.
Working with people.
One of my challenges is patience, I just really wanted to get my hands on people and, start working with people and making an impact, And
so let's talk a little bit about that.
Yeah, okay.
When people hear massage therapist, there is all sorts of things that come up in people's mind.
Absolutely.
You are here on Bay Street.
Yeah.
Not in Guelph.
Yeah.
You're in private practice.
Yeah.
What is it that why should people come and see you rather than anybody else that they find in a phone book or on the internet?
Well,
what is unique about you?
That's a challenge. Here's the thing that here's my sort of question and answer. The question to throw back at you is, what are the reason that you are coming for massage? Why are the reason that you want to come in and actually see me? That's the most important thing. People come to me for different reasons. Some people come to me because they're in pain and they want to have relief from pain. Some people come to me because they have heard that, I give such a deep and intense and impactful massage that, when they leave there that they're floating, or that they're weightless, and they want to experience that feeling. Other people come because, they want relaxation. Other people come because they want to use their benefits up before the end of the year. Why do they come to me in particular? I know that the patients that come and constantly refer their friends to me come to me because they know when they work with me that from the time they arrive to the time they leave, they have my unconditional attention, that I am focused on them, and my only goal during that period of time is to make their experience better, So that's everything from assessing what their needs are to understanding what their needs are, to understanding what their wants are, putting that all together, and then customizing the treatment specifically for them, and then delivering that. And also in the delivery, I mean, I say this is what I'd like to do. This is the benefits I'd like to accomplish in this session. But and as soon as we start, it's like things can change in a moment as well, and people accept that, and that's what they appreciate, is that it's an organic experience, and the treatment that you're getting, or the session or the touch therapy that you're getting is specifically for you. It's nothing that is. I guess the best way to say it is I believe a lot of therapists out there have a specific technique that they do, and they expect people to sort of like mold to their technique.
So fit into the cookie cutter approach. There's
right.
certain approaches.
Whereas I'm totally, like, to me, the more unique, the different, I love it. Come to me, throw me something I haven't seen before. Give me a condition to treat that I haven't treated before. Awesome. That's more exciting for me, because I'm going to learn something, but as well, I'm probably going to deepen my skills, and at the same time enhance their experience.
So how much of your evaluation of how you're going to go about this particular massage is defined by what the client says, and then how you use your intuitive skills? You come across as a very in tune person.
Thank
You
you.
pick a lot of stuff up about me and everybody else before we even say anything. That is what shows up for me, at least. How do you blend that?
Okay.
Do you, like, I'm thinking intellect versus your inner wisdom. So either client may come to you and say, "Oh, I have this problem."
Here's the thing. There's two parts to that.
How do you handle that?
So I think that, like, I've got to have a double personality with this, because there's the one part to satisfy, and the College of Massage Therapists of Ontario, the Regulated Healthcare Practitioners Act.
Right.
I need the intellect, and I have to follow certain boundaries and make sure that that the care is within all of the boundaries that are set out by these associations and college bodies. But from there, once I get past that point and I'm into the treatment, I think that the thing I have to do is leave that behind and let the intuition just flow through.
Yeah.
Always sticking with my principles that I've learned, in therapy, right, to keep myself and my clients safe. But, the rest is just, it's a very unique and incredible journey,
I'm just wondering, because you mentioned that example of when, if you hurt your head, you put your hand up there instinctively, right? Mm-hmm. I'm just wondering if you think there might be a little bit of magic in your touch, in the sense that, people talk about healing hands or laying on of hands, and that there's healing energy that comes out of your hands, and here you are massaging. Do you think you might have some healing energy that comes through?
That's okay. Separating the ego from myself right now. I think that, and I remember having experiences. I was working with this one individual who was paraplegic, actually, and this was where I was going into his home, and I was working with an insurance company. It was a catastrophic, and it was just so incredible, because I'd never worked with anybody like this before, but I believed that I could help him, and it was an acute injury, and he was able to actually, after several weeks, where he was walking with assistance, it was barely a step, but it was a step, it was
wow.
like, and I remember that feeling at that time, of just having all this, and like feeling like pulses in my hands, and I think that, I got caught up in, the experience of it, which was incredible. Objectively, I don't feel like I have any special powers that come through my fingers. I think that we all have this healing flow that goes through, it can go through anyone. I think the biggest thing for me is just to let go, as I was saying earlier, and just let things flow through, take things as they go. Don't get attached to even outcomes, like during the treatment itself, like being attached to a specific outcome. Let's set some broad goals. These are our intentions, but where we end up is sort of where we're going to end up. And so far, that's done really well for myself and my clients. Going back to the whole, healing, I back at around that time, like I found that I was very exhausted at the end of my days, and like literally spent, where my back would be sore and stuff like that. I'd realized and learned through an experience at that time that I started with a men's group called the Center for Health Self-Healing here in Toronto, and there to learn deep diaphragmatic breathing. That was a big part for me to learn how to. It took me a year and a half to really get it down. Deep diaphragmatic breath.
Wow.
Yeah.
So you take more cosmic energy in, and it flows more easily through you, rather than you're spending what's in here. You kind of open yourself to have things flow through more easily. Yeah.
I visualized myself then as a conduit rather than as a battery.
Yes.
That was like in my head, and I just I would close my eyes and just visualize that flow coming through me. As hokey as it, or whatever you want to say as it sounds.
It's scientifically proven. 80% of our life force comes from cosmos, 20% now, and the scientists talk about it, comes from the food we take in. The people who are opening themselves to taking more universal energy in seemingly are by far more vibrant than those who don't believe in any of it and don't breathe from the neck up, let's put it this way.
Right.
And study physiology, deep breathing, if I'm focusing on my breath, my mind can't run 100 miles a minute because my focus is on my breath.
Right.
Which gets my muscles all tense up in the first place, so I have to come and see you, maybe,
Yeah. Yes, I think so.
So let's talk a couple more minutes. I think we still have some more time about how you see. We talked earlier about the perception of stress and being outwardly focused and wanting to live in this world here in the West that seemingly is so hectic and stressful to some, yet not really impacting some others. How does massage fit in this overall health regime? Diet, emotional, psychological state, past traumas, whether they are physical, car accidents and so on, or the loss of a loved one, or job loss, marriage breakup, that type of thing. How does that hit the body? And how can massage help with that?
Well, and here's the thing: is that everybody is different. Everybody's different on how they take on stress, either in their lives or around them. Some people, it manifests physically and quite seriously. Where there's right away they have a spot. Excuse me. I have people that come to me and say, "Oh, I'm stressed. I'm getting stressed." I feel it, building up my neck, so I decided to come in. Other people, it's like a long term, so they're stressed for 2-3 years until all of a sudden it shuts them down, and people talk about chronic fatigue and fibromyalgia and dysfunction and or disease like this, and ultimately to me it's stress manifesting in the body, and stress that we're not taking care of. So everything as simple as what I would love to see, and I wish I had the ability to create the space in a center, is to actually have the support around. So I have a large room where I can do nightly breathing classes where I teach people how to breathe and how to relax. Because why have somebody come once a month for a massage and get them feeling good for 2 or 3 days? Why not stop? Why stop there when just for an extra 1 hour once a week they could come in and they could take this class on how to unwind and relax at the end of the day and get a good night's sleep. How much will that affect their lives? These are the sort of things that I think us, not just massage therapists, but all the health practitioners need to incorporate. I think there's 1 sleep or 2 sleep clinics in all of Toronto where they send you, and it's for the
sleep apnea.
Sleep apnea, and which is a serious condition.
Yeah.
And without getting into the treatment protocols and everything, but to me, it's you need to take a step back from that, and before it gets to that point, it's what are healthy sleeping patterns? So that's one thing. How do we handle stress? When it comes to this, 20, 30 years ago, we had religions and groups and support groups. We had block parents. We had all these different things set up so that when support was needed, there was a way to go. Whereas now there's a million different support groups, but nothing really that's, to me, that is concrete, that is there, that can just step out and you can depend upon for support. We've abandoned Now I'm talking generally, but I mean, I see a lot of us have abandoned, like even something as simple as the family dinner every night. It used to be sacred, 6 o'clock, 5 o'clock. No matter what happens in the family at that time, you're all stuck around the table. You got to put up with each other. You got to talk. You got to listen. You got to fight. You throw food, whatever it is. But everybody's there.
You have to deal with other human beings in a small
space, and and that's a good way to finish off. I just think like little things like this make a big difference. I know you asked me in regards to massage therapy. I think massage therapy is going to emerge as a very needed and very necessary modality and or treatment for many of the conditions that are now emerging, that are chronic conditions.
Well, I hear you say we need to become aware that we are living in this body, and we have become conscious of the signals the body is telling us, and then in conjunction with educational setting, let's say, such as you might want to create as well, people then can make new lifestyle choices with the massage therapist as a breathing expert or as even a counselor, how you can schedule your day so that you have an hour for lunch, etc. And, take the time once a week to start off with to have dinner with your family. Yeah. So I think you're bringing up very, very powerful points.
Here's the thing I see at work. I don't know how much time I have here, but here's the thing I see at work. So people are now at work, no big monitors, stuff like that. It's like laptops, where we've abandoned ergonomics, which was big 15 years ago. So now we're tapping these laptops, stuff like that. People are chronically stressed in their arms, from the tablet and the smartphone. Our postures are now like this because everybody's walking like this. We're separating ourselves further and further from consciously connecting with other people, even walking down the street now. Same thing, like this. I mean, I just see all of this around me. And then when people come in and they sit down and they do this, I'm not sure, hold on a sec. I'm not sure exactly why I'm feeling, but I'm like really tight here and, like my back, and I'm...
So while they're in consultation with you and paying you, they're still texting.
Well, anyway, so then like they come in, present, and I'm like, okay, let me just show you something, and then I'll attempt to go into the business, and they're like, is that how I'm sitting? And it's just that self-awareness. Yes. And then and then I'll work through, just to give you a quick. So one of the big things is when I see somebody first is, I do this body scan, we're all just, basically I'm palpating on the body, see how it pushes back, see how it responds or reacts to my touch. And, and then right away, I'll find these areas and people are like, oh my gosh, I didn't realize I was tight, or I didn't realize that hurt. And I find all these different spots. It's the same thing. We become so good at confusing and tricking ourselves that, everything's okay, just to push through. We stop feeling those feelings. We stop feeling those senses. We turn it off. And it's not turned right off, but it's turned off from our consciousness. So our body's still experiencing and still feeling the trauma, but, we're not doing anything about it. We're not consciously acting on it. So I like to believe that my interaction or my bumping up into this being, helps them to bring that
about new awareness about their body and how they're living. You've got a great example out in the hall. They're talking about women carrying purses on one side of their shoulder, and then muscles react to it, and we don't even know that our shoulders ought to be level, but they are not. They're one way or the other way.
So
but
true.
Because we get so habituated to it, I can totally relate to what you were saying there.
Yeah.
That is one incredible example of exactly how things get hardwired in us, and we are not aware. We are numb.
Yeah.
So habituated.
Yeah.
Well, thank you for being here and for taking us out of our numbness. And you are very close by. How can people reach you? Where's your office? Please let us know how to be in touch with you.
Yeah, I'm at 161 Bay Street on the 27th floor, Suite 2700. That's right at Bay in front. So, the easiest way is TTC. You get off at Union, and it's it's Brookfield Place. You know, you just take that little exit from Union Station. Right now I'm actually, because I'm rebuilding my actual one-on-one practice with my clients at this point. So I'm there from 10 a.m. to 10 p.m. Monday to Friday, and 10 to 4 on Saturdays. So, and it's online booking. So
on your website,
yeah.
VOSREMT, or is it, what's the website?
Oh no, here it's.
Do we have it up?
Do you know what? TorontoMassageTherapy.com.
We got it up there, right there. There's
Yeah.
the website.
Okay,
Yeah.
TorontoMassageTherapy.com.
Yeah.
Perfect.
Yeah, that's it.
Awesome. Well, let's hope that we get all unglued and our energy's flowing.
You know what? I have hope for us all. I truly believe that we're on that journey. So
I am an eternal optimist. I have to be, you know. I always say I needed to see my kids grow up. I hopefully will have grandchildren one day. And we all playing our role in sharing what we've learned, and hopefully it will make a difference, right?
I believe so.
Certainly you
Thank
being
you.
here made a difference. Thank you so very much.
Thank you. Thank
and
you.
I wish you much success and hope to see you soon.
You know what? I hope you guys invite me back. I really enjoyed this. Yeah.
Well, we'll talk some more. We have some interesting things to talk about later on.
Excellent.
Absolutely.
Okay, great.
Thank you.
Thank you.
Okay. All right. Is that it for the show today? I think it might be.
It might be.
If it isn't, we'll be back. But if it is, see you next time at
Thank you.
channel.com.
See you soon.